One of the questions is, how does Healthy People 2020 relate to the National Prevention Strategy? Carter?
Thanks, Emily, and that's a great question. I'm glad someone asked that. It's one that we get oftentimes. Healthy People, thanks to its large and rich collection of objectives, has been able to serve as the foundation for multiple initiatives across the federal government and across the past several decades. For example, specifically with the National Prevention Strategy, the strategy during its development looked to healthy people for the measurement tools to measure progress towards achieving the different directions specified in the strategy. We work closely with CDC staff and the Office of the Surgeon General to develop the measures for the National Prevention Strategy. So we were working together, and we continue to work together around the National Prevention Strategy. Allison mentioned that we're able to change our objectives throughout the decade with Healthy People 2020. So in cases where we may be revising objective for Healthy People 2020, we'll look to the National Prevention Strategy and make sure the people working on the strategy are aware of the changes so we can be aligned. And it's not only with the National Prevention Strategy where we're trying to align and coordinate. Healthy People has also been integral in providing a foundation for the National HIV/AIDS Strategy, for the Tobacco Strategy, and even the action plan to reduce healthcare-associated infections. So it really has been a successful few years as across the government we're aligning to ensure that our programs are in sync and coordinated. So that's one way that we try to focus and coordinate our efforts using the Healthy People objectives.
Thank you, Carter. Another question that we received is, I'm on the steering committee of Start School Later. We are working to raise national awareness of adolescent sleep loss. How can we raise awareness of the insufficient sleep objective for grades 9 through 12 among the decision makers? Carter?
Okay. There are different ways you could promote and raise awareness of the different objectives in Healthy People 2020. As you put out your newsletters, you have webinars, you go to meetings, you can incorporate those objectives into your presentations or your activities. You're also certainly welcome to call upon staff at the Office of Disease Prevention and Health Promotion to facilitate any activities if you need help in terms of reaching specific targeted populations. And we also at ODPHP have a pipeline to all the workgroup coordinators who are supporting Healthy People 2020 objectives so we could facilitate a connection there. But if I know the communications folks have a whole trunk full of ideas, so if anyone would like to add something, feel free.
Right, so following on that, Carter, we're actually going to have Jordan Broderick here in the Office of Disease Prevention address how one might develop a social media plan.
Yeah, and so I think the first step with any sort of social media plan development would be to find out what your audience is doing, find out what tools they use, however you have access to them now, whether it's something like email, reach out to them and find out what they want. Also, design messages that resonate with them. You can do this in that formative process of finding out what tools they use, but find out what they're interested in learning from your organization. We use Twitter and LinkedIn for our audience, which is largely health professionals like all of you on the line, or educators, and we found that those are great tools, particularly LinkedIn for engaging professionals with the types of content that we have. But really, make sure you do that formative research and then tailor what you're doing to what you find.
Thank you, Jordan. Another question that we've received is specific to partnering with Healthy People. One of the questions is, how do I register to use Healthy People, and is there a charge to become a member? Here to answer the question is Allison Roper, the manager of our Healthy People Consortium.
Thank you, Emmeline. And I'm so glad that you asked that question. No, there is actually not a fee to become a member of the Healthy People Consortium. We encourage all types of organizations, state, local, community, nonprofit, for-profit, to join our consortium membership. You can go to the healthypeople.gov website, and you will see a tab for consortium and partners. And you can just go on there and register and join the consortium. There's a toolkit on there right now, and there's some different ideas for how to become engaged. You can also contact us directly here at the ODPHP office for additional ideas on more ways to become engaged as a consortium partner.
Thank you, Allison. We appreciate your feedback. Another question that's come in is, how are the leading health indicators focusing on health disparities? Here to answer that question is Debbie Hoyer.
I hope you all have been attending our monthly series, Who's Leading the Leading Health Indicator series. And each month we put out a monthly bulletin and a webinar. As Carter stated before, Healthy People is really data-driven. So data is one of the central components of these releases. The releases consist of an overview of the topic area, a community story, so someone in the ground level who's actually doing something to achieve these objectives, and then the latest data and trends for each of the objectives. And like I said, we comment on the trends, but we also focus on the disparities within each indicator. So we work closely with the National Center for Health Statistics to analyze and report those disparities, and also to draw attention through, you've seen in this webinar, the different infographics that we use. So we really try to drill the point home by using these infographics.
Thank you, Debbie. Another question that's come in is, what suggestions do you have for local and federal public health professionals to capture all the existing evidence-based interventions and promising practices that are occurring throughout the nation in all the places where public health practice happens? Here to answer that question is Teresa Devine, who's going to share with you more information about our sharing library.
Sure, and I think Healthy People is really moving in that direction to really promote sort of the evidence-based resources that are out throughout the country that are working towards Healthy People objectives. And so the first way is the sharing library, which we had mentioned earlier, which is slated to launch in early 2013. And what that will do is really compile community stories from across the country. So it'll look at communities, local and state organizations, programs at a federal level also that are really working to implement Healthy People in their own communities. So sharing their stories with what sort of programs are working in their community, what sort of collaborations they're working on in terms of partnerships. And another way that I think we're really looking at evidence-based interventions is twofold. One is the search evidence queries, which we've discussed earlier in the webinar, which really is a partnership between the Office of Disease Prevention and Health Promotion and the National Library of Medicine. So if you go to each objective within the 2020 Topics and Objectives tab, many of our Healthy People 2020 objectives will have an icon linking to a Pubmed search strategy. And we will be revising and updating those throughout the decade to include that search strategy for each of the objectives. But what that will do is it will take you to a search strategy that has already been populated within Pubmed, and it will pull back results related to that very specific objective. And it's really pulling back published literature that has been peer-reviewed on interventions that are working in that community. And the last sort of prong of this working on evidence-based interventions is the evidence-based resources of advanced search. And I'll let Emmeline Ochiai respond to that.
So the evidence-based resources advanced search that will be made available in 2013 will identify specific evidence-based resources and interventions that have been selected by subject matter experts within HHS. Those evidence-based resources will have been selected by specific criteria that have been vetted by the department, and they will include both systematic published resources, non-systematic published resources, and other published interventions. All of the resources that will be displayed will also identify what type of resource they are. So, for example, if it's a randomized controlled trial, if it's a case study, those will all be revealed to you as part of providing you with open details about what's included in the specific resource itself.